Welcome back. We're here with Marco Maldonado, who is a medical assistant here at HealthGAINS, and there's so many things that they help people like you and I and Brenda with at HealthGAINS right here in South Florida. And we wanted to talk a little bit about something called PRP, plasma-rich platelets. Tell us about those.
It's actually platelets-rich plasma. It's a term for PRP.
I mixed my P's up. Tell us about
it. This therapy, as I said before, is the platelet-rich plasma, which we take it from patient's blood. So we spin it and we separate the platelets from the plasma and the red blood cells. So we are going to inject those platelets already activated. In the case for sexual wellness, we have the regenerative therapy, which we're gonna enhance the restoration of the blood vessels, creating new vascularization and repairing the old blood vessels for better blood flow response with erectile function.
It's for men and women?
We can do it for both. And in the case for males, we call it P-shot. In the case for females, we call it O-shot, which goes straight into the G-spot, which is the clitoris, which is a similar tissue as the cavernous in the case for males.
Okay. Stem cell. What do you do with stem cells to help?
Stem cells is a similar treatment. In the case for stem cells, we get them from, there is a company who preserve the umbilical cords in the hospital, so they take those stem cells and they preserve it in vials. So we can save those vials here in the cryotherapy, and we take those vials and we inject them in the patients right after the GAINS wave. So with the GAINS wave, we are looking for some inflammation. Once we have the inflammation and those little damages into the penis, then we can go ahead and inject the stem cells that are looking for site of inflammation. They can attach to those sites and they can transform in that kind of tissue, causing a restoration.
So you can have both men and women in this form. It's just
we can use it for women too.
It's amazing.
So it can be done for sexual things, but it can also be done for joints.
Correct.
And places that you have a lot of inflammation.
A lot of inflammation. We can use it for joints. We can use it for hair restoration. We can use it for scars, for many different things. Actually, this therapy was originally developed for cancer treatment and many other diseases with inflammation.
Yes. Regenerative therapies. What does that refer to?
Well, it's about the same term, like to take all those treatments for either sexual wellness, for better energy. So it's kind of about the same, but just to take everything in the same place.
So when you hear about regenerative therapies, you're talking about all of these things where you can regenerate, rejuvenate and regenerate parts of the body.
We can cause a rejuvenation or regenerate those cells for the proper function.
Man, because we get older, I guess our cells start to age too, and they lose their function.
Correct.
Right.
Yes.
So my knees lost my function.
So in the case, for example, for PRP, we use exactly the same treatment, but for the scalp for hair follicles restoration, and you can see in many different places they offer PRP for scalp. Some patients they see results, some others they don't. What we do differently here is we have the combination of this therapy with peptides. We have a couple of peptides, which is the GHK Cooper and the thymosin beta 4. With those are going to help with the signaling between cells to create a restoration in a fastest way that you can do it with even just the platelets.
And you helped develop this, correct?
Yes, I've been doing research for a few years, and we noticed that we can see a lot better results with a combination for all the therapies, including certain vitamins, the peptides, the PRP. Everything together is the key to actually have really good results. Some patients, they try just one therapy separately and they don't see major results.
Right, and so you have a lot of different options. Right. There's a lot of ways to treat the issue, and they can do it for you here at HealthGAINS. Again, don't be afraid to walk in the door, to call them and tell them you saw us on the show or that you want to learn more about this because you want your life to be a little bit better. And they can do it here at HealthGAINS. Marco, thank you so much.
Thank you so much.
Good to see you again.
Thank you.
Back after this.